Good evening, everybody, and a really, really warm welcome to this series of Fireside CPD events for clinicians on behalf of Portman Dental. My name's Andy. I'm an old face, of course. You'll know me from previous sessions. I work in the talent team at Portman, and I've got the pleasure of hosting this particular series of events. We've got some brilliant clinicians lined up for you. My favourite of which we've got coming up straight away. I'm going to ask him in just. I'm going to introduce you to him in just a second. But there's a couple of ways that you can get involved in the conversation tonight, team. If you want to ask a question, please pop a question in the question box that you can see in your go-to panel, or you can see a little raise your hand icon. Raise your hand and I'll bring you on mic and have a chat with our presenter this evening as well if you've got any questions at all in relation to the content of the session. We do, of course, offer 1 hour CPD for the session. We meet the criteria of the GDC for that. We've got all your email addresses, GDC numbers, names, etc. So if you stay in session for the full hour, then the CPD certificate will come your way. It is a manual process, so bear in mind, bear with us about the issues of those certificates, but they will be with you in due course. So I've told you about questions, and now all that's left for me to do is to introduce our top first speaker for this evening, for the series. Delighted to welcome one of our newest acquisitions in Portman, but very quickly made a massive impact in the business. Dr Grant McAree from Whyte House Dental in Topsham near Exeter in Devon. He sold his practice to us, and he's got more experience of doing this sort of stuff than you can shake a stick at, team. So I think you're in for a real treat this evening. He's going to be presenting this evening on how to ethically increase your turnover through the power of marketing and clinical sales techniques. And who wouldn't want to do that? So without further ado, Grant, great to see you this evening, and I'm going to hand over to you, matey.
Thanks, Andy, and welcome to everybody who coming to listen to me. It's always a great pleasure to, and it's very humbling for people who take the time out of their evening. And Andy, I don't know how I feel about you saying, I've made a great impact on the business, because I've only been there a few months. I hope that's complimentary. So yes, how to ethically increase your turnover through the power of marketing and clinical sales techniques. Isn't it funny that everybody has to add ethically when you ever talk about increasing your turnover, as well as marketing and sales, because it is a dirty word, isn't it? That's the problem. But so I always like to call this speech, or the way I like to just show people how you can increase stuff ethically. I like to call it ain't rocket science. So that's sort of my words I use on all my Facebook pages. So here we go. Look, the biggest thing I like to show people, and when I go into practices and help them build their practices, you just can't get lost in all this latest technology. People want to be on Instagram, people want to be on Facebook. Don't get lost in it, and it also isn't just word of mouth. Okay, now it might be word of mouth, but in 6 months, a year, 2 years, I think people are going to struggle if they've always relied on word of mouth. Testimonials, opinions, reviews. You're being watched and researched. Now, why? You ask your wife, your husband. You say, "Look, I want to go away." Where do they go? They go to TripAdvisor. They look at the reviews. It's the same as dentistry. And I don't know how everybody feels about that, but over COVID, I feel as though people have become a little bit more tech savvy, and they're more into looking at the reviews, more looking into what other people feel about you. So times are changing. Patients are more transient. They're going to come into your practice. They're going to want things like Invisalign, implants, and they're going to leave again. And they will rely purely on testimonials, opinions, and reviews. So please don't forget, it's not just word of mouth. Word of mouth works. And when I started dentistry 20 years ago, word of mouth was the best. But I love Dolly. I remember going down the motorway. I had my roof off, going at about 90 miles an hour. I got stopped for speeding. I love Dolly Parton. But you know what? Islands in the stream, forget that. This saying is fantastic. We cannot direct the wind, but we can adjust the sail. So it doesn't matter if you work for Portman. It doesn't matter if you're not the owner of the practice. You can adjust your sales. You can adjust things to make it right for you, to make it better. You don't have to always, you can push the boundaries, albeit we all have to work within the policies of a practice, but you can adjust the sales. And I think that's the most important thing. And I've always pushed the boundaries. And I suppose Portman will probably realize I do like to push the boundaries, but always within an ethical area. So a little bit about me. This is my first practice. It was in Dundee. Now, if you think that, places are rough around Bristol and London, this was an absolute dive. I paid my way through dental college and I built my own chiropody practice with my dad, and my dad was a dentist. The first day we were working and someone was getting a right shoeing outside, and we To this day, the nurses who I absolutely hold in great regard, the nurse said, look, we wanted to go out and stop the fight. The guy was giving him a shoeing, as I said, and the nurse said, you can't go out there. So we stayed behind, and apparently the guy that was getting the shoeing had actually stolen the guy's granny's checkbook that the guy was getting the shoeing from. So this was really law of the jungle. And so back in the day, I started my first squat practice, and we didn't have social media, we didn't have Instagram, and yes, it did rely a little bit on word of mouth, but it also relied on paper adverts and traditional marketing. I then 6 months out of VT, I built a 5-bedroom house, and I can safely say I did not know how to run a dental practice. So it was about a 5,000 square foot house. I bought it, started sticking dentists in, and it must have been a nightmare for staff. I think at one point I lost every single staff member because I didn't know how to run a team. And I suppose today I still don't, and that's why I probably build, I change every 4 years. I'm like a chameleon, I change my sales, and it's okay to do that. And I'll change again probably. And in those days, I built the practice and moved on. I decided to build another 5-bedroom house. I thought, right, I'm going to find my feet, learn about business, learn a little bit about, but I still didn't. And I bought this house. It was haunted. So I got a complaint that they could hear the family screaming every time the nurses were closing down. And I don't know if any of you old timers, the ones with grey hairs on their chest, men and women, I suppose, that we used to see a help button on the advanced software. So the help button came on. It was an absolute nightmare. And then the last person in the building always heard a scream. So I still dream about that place. But it was busy. And if you see there, I built a property practice on the side of it. So I was always looking for the opportunities to build practices. And then I bought this one. This is the one actually that Portman had bought off me, but I had amalgamated a number of practices as I built up. And that's all different branding now from the people who know in Portman what they bought from me. It's different branding. So like I said, every 4 years I like to change, and that's still okay as an associate. It doesn't mean you change the practice. It just means you change the direction in which you're going, just to keep it alive. Because I think dentistry, you can ride on the crest of a wave, can't you? And when, my God, it's an amazing job. But when it hits the fan, I probably think it's the worst profession you can imagine. And I've been there. I've had a GDC investigation. I've had a law letter sent, and it was all in the same day. And I know what it's like to be sitting there doing patients, and the sweat is just dripping off the back of your neck, and you're thinking every single patient that's coming through the door is going to see you. So I do know what it's like. I then bought another practice, and then, like I said, the rest is history, really. I then amalgamated all the practices into one. I then decided to, which I thought was extremely cheeky, I had zero experience with orthodontics. I think I'd done a weekend course in the Inman, so I thought, well, what a better idea than to open a teeth straightening and whitening and hygiene practice. And you know what? I wasn't perfect. I've lost every single one of those members of staff, apart from the lady on the right that's actually in the building, not the one that looks like she wants to kill me outside. Fortunately, that's my wife. That's why hopefully she won't leave me. But the rest have, so nobody's perfect when it comes to running a business. And social media is just all about being perfect, isn't it? And that worries me the most, that everybody looks towards Instagram and thinks that that's what they want to try and achieve, that perfect smile. They're composites from 6 to 6. I just think everybody needs to slow down a bit. And I can't talk. I set up a practice I didn't know, but fortunately, I went to IAS training with Ross Hobson, and that changed my working career really. And then I managed to go on to Invisalign and become a diamond provider. Apparently, it's top 1% Invisalign providers, but getting the proper training, I think was probably the turning point in my career. So I don't have that sweat dripping down my neck and going down into my backside when I'm sitting there, sweating, thinking that every single patient's going to take me to the GDC, or every single patient is going to sue me. So I joined the Portman family. Now, why did I join Portman? I was asked that the other day. I haven't a clue who this family are, but I thought, well, they said that it was a family affair, and that their USP is a family. I've enjoyed it. I've been here for 4 months, and I safely say I mean what I say and say what I mean. So if I wasn't enjoying it, I don't know if I'd say it on this evening, but however, I would be quite vocal about it. But I actually say that I'm really quite enjoying it. I've managed to discover what it's like to sit and do dentistry again and not have to worry and not have crying patients and staff, and albeit I've managed to re-engage with staff who are now more friends. I can sit upstairs, I can have a laugh. I don't have that thing breathing down my shoulder. So, but I've come to probably the crossroads in my life when I'm 50. So I've been given an enormous opportunity by Portman just to be able just to relax. And I had the choice of many corporates, IDH. Well, it's not IDH anymore. I sold to IDH. I don't think IDH would actually sell. another practice to me because it was such a disaster the last time. But, you know, I have sold to different people, but I think that so far I'm actually having a great time. So that's really, really cool. But look, you know, I got 2 O levels at school. I managed to scrape 2 A levels, geography and English. I've never done a science in my life, and that's the truth. I best not say how I managed to get into dental college. Probably slightly unethical if there's any GDC listening. But seriously, if I can do it, anybody can. And you know what? Building businesses, you know, converting patients, becoming an Invisalign provider, and that's my signature. It ain't rocket science. And you know what? Isn't it a dirty word, sales? Sales is the dirty word. I mean, I see it on, I've got a Facebook group with about 5,500 people, and people are always saying, oh, we're not selling. Of course we're selling. We all sell. Selling is just what you do to receive something in return. It doesn't matter what it is. I sell that, you know, I'm going to be rude. I don't care. I sell to my wife to get lucky in the evening. I sell to my kids to do their homework. We sell every day. It's what we do to survive. It's what we do to carry on. So, you know, when people come on and go, I don't believe you should be able to sell in dentistry, it's like that. Well, that's fine, but you are selling. Even if you don't market, you don't advertise, because marketing is just a vehicle that you use to sell. And if you're not marketing, word of mouth is selling. Sitting down and listening is selling. So we do sell. But, you know, why do we think it's so bad? I mean, I love this program. You know, again, it's the grey hairs on the chest. It's Minder. I loved it. And, you know, it's the people like this, I suppose, when they use unethical means to sell. And I suppose there are dentists out there that do sell unethically, because it's not part of dentistry and selling that's unethical. It's actually the person. It's the person who is unethical. And we mustn't lose that. So it's okay to sell. So selling is what we do to get something in return. So whether it's you listen to a patient and they pay you money, that's selling. And marketing is the vehicle, the branding, the thing that you shouldn't turn off because there's a recession coming. And I do think there is a recession coming. But if you turn the marketing off now, in 6 months to a year, that is when you'll experience the pinch. So the marketing is more of a brand awareness that is around, and it's around, you build it. And then when you get the patient in the chair or from the immediate talk on the telephone, that's part of the sales process. But you know what? It isn't for everybody. These modern changes, it isn't for everybody. And I'll go around to practice and I'll say, look, why don't you try a little bit of Instagram? Why don't you try a little bit of Google My Business? Why don't you try Facebook? And it isn't rocket science. But you know what? It isn't for everybody. And that's fair enough, you know. But all we're doing is trying to find a solution, trying to solve what the problem is for the patient when they come through the door. That's all it is. So the patient has a problem and they come through the door, and all you've got to do is find that solution. And that's how I love selling. I breathe selling. And it's not a case of trying to get the best. It's not a case of trying to get that £3,500 pounds out of a patient who shouldn't be having Invisalign. It's about me saying to that patient, look, you're not ready for it. We're not allowed to do it, because I tell you what, that patient will go and tell 3 others who are able to have it, and they'll come back. So it's just finding it's finding the solution to the problem. So people will say, oh, well, dentists, we shouldn't be marketing. The GDPs don't do it. So I thought I'd do a little bit of a search. Plastic surgery and advertising agencies, my God, hundreds. Look at that. There's 11 million searches. So that's an enormous amount of searches on just plastic surgery. So the next time I had a discussion with someone, they went, oh, yeah, but that's plastic surgery. They're not really that professional because they're into the sales bit. So I thought I'd do orthopedic surgeons. And there was just as many. There was about 15 million searches on Google when I put that through. So it's coming. Everybody has to get with some kind of sales. And that includes Portman, that includes everybody. I feel that we shouldn't lose ourselves, but we shouldn't certainly ignore the way that the population is going and how they look for their dental practices or the products that they're looking for. Because if you look at the girls upstairs in your staff room and they're looking for their nails done, they'll flick in, it'll be 2 seconds. I mean, you haven't even got 2 seconds now for adverts. So they've got to be catchy, they've got to be a good branding. So where do I begin? I mean, that is it. Where do we begin? And that is the key question I get from a lot of people, you know, and it always starts with your passion. You know, that's any lectures that I take, it's got to start with your passion. It's got to be one of the 5. There's only 5. There's to bond, to feel, to acquire, to learn, to defend. And it's got to be one of those. You know, it doesn't matter that you've got a passion to acquire. I have an incredible passion to acquire. That means I want to acquire practices. I like having a good living. It's okay to have that passion. You know, it has to be balanced. Fortunately, I do have a passion to feel and to bond. I also have an enormous passion to defend. If anybody tries to set up in my street, unfortunately, I have tried to stop, ethically, of course, to stop them setting up. But that doesn't mean it's for you. So if you find out which one you are or which one resonates with you, you'll find what you can advertise, what you can market. So if you've got a passion to learn, if you've done an extra degree, if you're a specialist orthodontist, don't put out your prices. Don't put price-related adverts out. Put out blogging, put out the journey. If you've got a passion to feel, you know, do the journey with the patient, shaking hands before COVID, of course. So make sure you find out which your passion is. And if you find it, that's the advert. That's what will resonate with you. And I promise you, if it resonates with you, all your adverts will be a success. As I said, I've got a passion to acquire. So all my adverts is financially based, discounts, open days. I do an open day every single month, and they're always packed. So but that's my passion. That's what I want to do. I make sure the photos are amazing. So, you know, that's where it is. You've got to find out where your passion is. A lovely one for dentistry is a passion to bond. And that's when you see the beautiful photos of how someone's, you know, held the hand of a patient through the journey. And sometimes we just sort of get lost in dentistry a bit because, like I said, it's a really, really stressful job. Find out which your passion is and then use the adverts that relate to those individual passions. So, how do you sell? What is my secret of selling? I mean, I remember when I was a kid, I used to sell golf balls on a golf course, completely unethical, but I was only 11. I remember I used to sell golf balls I used to find in a field that I shouldn't have been in because it was the farmer's field. I used to crawl around because it was people weren't allowed in there. So I'd go polish up the golf balls and I'd take them onto the golf course. And I knew that if I could see, I just knew who to go to, who would sell to me. So the Americans, they always like to have a banter. So I would then ask one of their friends, I'd say, well, do you think he's right with the price? And they'd start arguing. With the British, I would go in with a limp and then I started to have a stutter and ripped clothes, and that worked for the Brits. You know, it's completely unethical, but you know, serious note though, it's actually looking from the patient's perspective at you. So when they sit in the chair, you've just got to see it from their point of view. And you know what the most important thing is? You've got to look in their eye. Have you ever gone to a T-junction and you want to come out of the T-junction? The only way to come out of that T-junction is to look that person dead in the eye. Because you know why? It's so much harder for them to see you. You look in their eye and it's so much harder for them to go, I'm going to go right past and not let them out. So obviously you don't hang out the car like a plonker like this chap, but look them in the eye, see it from their perspective. So it begins. You have 66 days apparently. So if you've got something that you want to change, whether it's giving up smoking, whether it's losing weight, you have 66 days. You've got to do something for 66 days to change your mindset. And that's quite tough, you know, because I know for a fact that when I provide a course for dentists, I know they're all fired up. They're ready to go. And in 10 days time, they'll come back and go, what was that again? And they were so fired up about that. So you've really got to want to change, you know, you've really got to want to be that different person. You've really got to want to excel at something different to change that mindset. And the mindset is far stronger than any conscious decision you'll make. And that's why when you're driving along in the car and say a child shot out in front of you, you'd slam on the brakes before you've even thought about it. And that's the difference between mindset and the consciousness. It's almost subconscious. The mindset is sort of dug in there. So you have 66 days to change. But if you are coming to your end of your career, like I suppose I've got, well, God, I've got another 15 years left. If you're coming to your end of your career, the ship has not sailed. It's never too late for anyone, you know, it's never too late to make a change. If, you know, if dentistry is getting you down, and like I've said, it's got me down in my past. I remember when I had a GDC investigation, I was sitting on the bed and I was reading through what articles, what my chiropody degree could do, whether it would pay my mortgage and stuff. So, you know, it can be really, really tough. And I'm very open about, you know, the depression, the anxiety, therapy, the stuff I've been through in my life to become where I am now. So it's never too late, you know, it isn't too late. However, I'm not bloody well doing that. I will not get up and dance with well, I'd probably dance with my daughter, but I'm certainly not putting a TikTok out. And Clubhouse, I've tried, but it's just not for me. I've done a bit of it. I think that it was great in lockdown, but it's coming. It may increase. They were offered something like 20 billion to sell Clubhouse, and they didn't sell it. And I think it's just petering over. And I think times will change in the future. I don't think it's Clubhouse. And six months, 6 years is a long time in social media. Will Facebook be around in six years? I don't know. I know my daughter doesn't read Facebook, bit of Instagram, and certainly my son isn't on Instagram. They're on Snapchat. So, You know, if Snapchat's out there, I would, and any of you are starting to look into marketing, I'd certainly look into doing a little bit of Snapchat. So my golden my golden nuggets of marketing. Look, you know, my number one, which I hope people do when I do my course, you cannot beat this if you want to increase revenue, and it is in line with GDC regulations. You modify your exam template. Now, if Portman just did this for every single practice, they would see an enormous increase in turnover. So what do? You have if it's SOE or R4, you will have a set template. And when the patient comes through the door, they'll put the template over to the exam template. So the nurse will then have the conversation with the dentist. The nurse will say, extraoral, any problems? No, there's no problems. Then you'll go into intraoral, you'll do the BPE, and then you'll come along to crowding. So the nurse can say, does the patient have any crowding? And you can say, yes, 3 millimeters in the lower arch. And the nurse will then say to you, do they have any gingivitis associated with the crowding? Yes, there's plaque trap, gingivitis. And then you can then go on to gaps. Has the patient got any gaps? Yes, they've got gaps. Is there any possibility of over-eruption or problems or periodontal issues with tipping of the opposing teeth or the neighboring teeth? Yes, the occlusion can be disrupted. Now, you don't need to say anything to the patient. All you need to say is that to the nurse. Now, when the patient sits up, if you use words like over-eruption, gingivitis, periodontal disease, tipping, the patient will turn around to you and say, can you tell me about gingivitis? Can you tell me about over-eruption? What's happening with my teeth? And they have opened the door. They have then given you the opportunity to look them in the eye and say, this is what I offer you. The nurse has done great notes. The GDC will love you for it. You've done a thorough clinical exam, and you can modify your exam template to whatever you want to do. You can do whitening, spaces, you can do crown, anything. Facial aesthetics is probably the one I would probably try and avoid. I don't think I've ever said to any patient in my life, by the way, I do Botox because I think it could benefit from you. What you can do, you can say, I know you don't need it, Mrs. Smith, but here's a card. Can you pass that on to any of your friends? Here's a discount on Botox. Now, that was something Harry Singh said to me. I think that's brilliant. So if you're going to do facial aesthetics, give them a card and say, look, you don't need it. However, any of your friends want it, job done, send them in. Okay, look, use genuine testimonials, as much information as possible. It's free marketing. Why does everybody give free free whitening away with Invisalign? I did, but now I want something back. I want them to be able to post 3 posts on Instagram. I want them to be able to do two posts on their main thread and a story, or they'll be charged for the whitening at the end of the day. Why not? Nothing should be free, but we just give it away and don't think how we could use it. So if it was me now, what I'm going to start doing is you give them the price for the straightening, or whatever treatment it is, you give them the price for the whitening and you put a price on it, actually on the estimate, and say, you will be charged for that if you don't give me 2 free posts and a free your story during the treatment. There's no broken promises. There's no contract that needs to be broken. It's easy because you can just keep reminding them every time they see them. Say, look, we've got another week. That's what we agreed. But I'm quite happy if you pay me £300 for the free whitening. It worked. So that's what I'm going to be doing from now on. And look, that's what she was brilliant. This was it was an influencer actually. She had about 100,000 people. She was a surfer, and she posted, and we got so many patients for it. And I said, look, can you really put as much information out there as possible? But it does work, and get yourself tagged. It's also free. I think when times change, I don't think that there'll be websites. How many times have you ever looked through a website? Seriously, how many times have you gone through every page and looked at a website? My God, it is so dull. I think what's going to happen in the future is it's going to be a 1-page landing page. So you will go on. Don't spend £6 on a website. Landing page, single landing page to social medias. But I think you get on their feed. Let them use the word Botox. Let them go to jail because they won't go to jail. You will if you use the term Botox as well. And you're not allowed to use wrinkle treatment. You're not allowed to use anything that relates to the Botox of which you're providing. So BTX, botulinum, you're not allowed to use any of it. So that's all gone now. All you can advertise for is filler, and you can also advertise for a facial cosmetics consultation. So that's all gone out the window. So big laws. And obviously, as you know, you can end up in jail if you do any Botox and filler, I think, for under 18. But if you've got the patient in there, get on their website. They'll love it. Get on their feeds, because that's where, you know, patients will roll in. Well, look, if you've got a passion to learn, I mean, why don't we see more blogging? If you look at if you Google anything in Exeter, I'm #1 with all my blogging. And there is a secret to blogging. People will go, oh, I'll write your blog about Invisalign. I'll write your blog about, you know, dental implants. But there is one secret that you can do to make sure you give good content. Now, the secret to Google is if you put fish and chips into Google, you'll get fish and chips out. Now, if you put fish and chips into Yahoo, you'll get shark, everything, because it's not quite as good, because Google depend on actually giving the person searching relevance. So in other words, you put it in, you get it back out. So what you've got to do, you've got to write something that Google will go, right, this person knows exactly what he's talking about. This person, we're going to give him the #1 spot, because he's actually answering the questions people are actually asking about Invisalign, about dental implants. So the next question is, what are the questions? They're there. They're there. Here we go. People also ask. If you want to write about content, just go to Google. Just people also ask. Now, they will give you credit for answering those questions. So if you're going to do blogging, answer those questions. You know, the funny thing is, if you run out, hit that arrow, you get another 4. That is all the secret to blogging. There's no massive thing. And as I said, if you don't believe me, if you go onto anything in Exeter, you know, whether it's Invisalign, whether it's gum shields, you know, I was really heavily into blogging before I sold to Portman. Now I can relax and ease and just enjoy the job. But, you know, if you enjoy blogging and you've got that passion to learn, you know, that's where to do it. It's brilliant. Anyway, that's a really good tip. Now, I love this. Surgery 5, #5 is actually surgery design. Now, what I've tried to do, I've tried to not make it for practice owners. So it's about associates as well as practice owners. A lot of my lectures are to practice owners, but I've tried to sort of, you know, do it. But this is easy for an associate to be able to utilize. So, you know, I always have everything in the same spot. Now, I'd love to say this is my surgery, but it isn't. It's similar, but it isn't my surgery. Now, I'm not so sure about this ceiling TV. That's always a bit odd having it there. But anyway, I've got a TV at the end of the table, at the end of the chair. I have a scanner on the right-hand side of me, and I have an iPad. Now, the reason for that is when I'm talking to a patient, I want the patient to be able to see the television at the end of their feet. So then they can look and think by the time that patient, which I will explain a little bit later on when we do the perfect what I think is a perfect consultation. The patient will be down, they'll be having the scan. I'll know if they've got a class 2 Div 2. By the time the patient gets up, I will then put a before and after on my television via an Apple TV. So I will change the photo at the front, at the bottom of the feet, and then I will discuss the patient. And every time the patient will sit up and go, God, they look like my teeth. Now, they have already internalized the fact that you can treat them without even looking in their mouth. But I also have, if I was sitting on the left side here, well, if I was sitting on the right side, my scanner would be on the right side there over my shoulder. So they can then see the possible outcomes of an Invisalign case. So, and the angle of the scan will always be the angle that the patient doesn't like. So you can show them the benefits. So you can show them what it's like. So around them, you haven't had to give the hard sell. You don't have to give promises. And it's not unethical to do this because it just gives the patient the time to be able to acknowledge that you do actually treat these things. So that's a surgery setup, and that's how I've always had my surgeries. And the TV at the bottom is a real winner. And like I said, an Apple TV is 75 quid, and you can have on your iPad, which is on the right-hand side there, you can have your iPad changing the photos when you know what that patient wants. And you don't need to even point to the TV, because when the patient sits up, they realize you actually do treat their malocclusion or whatever it is you're doing. So that's Dr. Nick Simon. I nicked it off him ages ago. What a result. So if a patient has gaps, I just put that up or something similar, and you know, they would suddenly realize that this person is capable of treating the stuff I've got. And if you are doing, or if you do have scanners, I know I'm going to not just concentrate on Invisalign, but Invisalign is what I do 100% of the time, 3 days a week. You've got to show them what it's like without any IPR. Why? What I do is I give the IPR, I show them what it's going to look like with the shaving, I reduce the overjet, and then I say, and so this is what your teeth are going to look like. I don't wait for the objection. I don't wait for them to talk about online braces. I say, right, I'm going to take off all the IPR now, and I show them that, and I say, that's what you'd probably get if you've got any online braces. For God's sake, don't say, or don't use any firm's name, but I do demonstrate to them. So almost that is in their head. Okay, right, I'm not having online braces. That's not how I want my teeth. That's all that's necessary. You don't need to downgrade any other business. You can just show them what the difference would be. So number 6, do some basic posts. Even associates can do it, but I would speak to the principal or wherever you are to see if it's okay. Get a good agreement on who owns the goodwill for the people or for the patients that you get, for the patients that you accrue. Because in my heart of hearts, it belongs to the practice owner. They've provided that space for you, and you know what? If you're good enough, go and do it yourself, and then just don't bother taking patients with you. Just say, look, I want to get some, I want to practice a bit. Can I do a little bit of Instagram? But just get a good model, go get a good agreement, so you end up not falling out over it. But this is it. This is all you have to do in any advert. And I see so many people making mistakes. Do you know what? Even if you're looking for an associate, you have to make sure when you put the advert out, just have these 6 or 7 points in whenever you put it out on Facebook. So you need to put a shout out in. You need, if you're going to spend a fortune on marketing, what's the point? So like Facebook, the difference between Facebook and Google, you're actively searching. So you're going like that. I want to get my teeth done. I want to get a fence built in my garden. So a fence company will come up. The difference between Facebook usually is it's a display network. In other words, they'll just come along and go, there you go, there's some fences. And you're like, well, I wasn't ready for fences. So what you've got to do, you've got to shout out. You've got to say who you're speaking to. What's the point in putting an advert out on Facebook and not saying who you're speaking to? What's the point in saying, we create beautiful smiles? You're like that, well, where are you? Who are you? I can't be bothered. I'm moving on. So the first thing has got to be, hey, Exeter, hey, Dublin, hey, wherever you are, say who you're speaking to. And that includes, like I said, going to the associate. You've also got to say the benefits. You've got to say the smile I've always wanted, the smile you've always wanted. You've got to add maybe an emotion to it. You've got to, add something else in to make them go, right, there's a benefit from me coming to you, You've also got to introduce yourself. So remember, if you do your name, you have to make sure you do your GDC number. That's GDC regulations. You have to write your GDC number if you're going to write your name. That's imperative. And also, you have to say, not everybody can have this treatment, and a full assessment is required for you to be able to have the treatment. Do you know what? You've got to state the offer. There's got to be an offer there. Everybody loves a bloody freebie, don't they? You've got to say what the offer is. But you don't have to stick on it. You don't have to focus on it, but you've just got to state it quite clearly. And remember scarcity. If you're going to put leaflet, I've had leaflet drops out that, I've managed to fill a whole dentist with leaflet drops, but it's all about scarcity, and it's all about saying, hurry up, you've got to come now. You've got to make sure, you come along now, or, or it'll run out. And of course, websites, telephone, treatment details, you've also got to say that, because they've got to know where they're going. Telephone, they've got to be able to contact you easily. I did see an advert the other day, and it had great treatment. And where's the telephone? You had to go in to the advert, then to the landing page, and then the telephone. Oh, forget it. You need the telephone number right there, so they can hit the button because they like the photo. And the website, telephone, like I said, and images. I think, do you know what? I think images is probably one of the most important parts of the advert. And I'll tell you why. And I'm going to show you how we look at an advert now. Don't get the picture in the middle wrong, because they won't do the rest of it, And the second line after the picture has to be the punchline. That's the bit that says free Invisalign consultation or open day Invisalign. That's the most important bit. You've got to make sure you see how people read adverts. And look, this is a great website. If you don't have any photos, I photograph everything now, and that's part of the ISA pathway. If you don't have any, Unsplash is amazing. It's got some really beautiful photographs. If you put dental implants in there, there's some really, really trendy stuff. Love it. And there's like that skeleton with implants in there. It's really, really cool. Love it. So Go to Unsplash, www.unsplash.com or it's .co.uk. I can't remember. Just obviously just Google it. And do you know what? Like we say, photography is easy. You know, I'm not a great photographer. It's good for legal protection. It happened the other day. Patient sat in the chair and went, "Oh Christ, I didn't have this recession." Said, "Oh, just wait a minute." Went back, showed them the photo. "Well, you did," and they went, "Oh, fine." So that completely, you know, sorted a problem out that could have gone on for months. It could have gone GDC, could have had legals, but no, it was there when it's done because I had a photography. So if you're going to do anything, you've really got to get your photography a little bit. You don't have to have the photography that we see on social media, and God, aren't some people brilliant at it? I mean, you know, some people are so good at it. That's not me. It's great for, you know, marketing and advertising, and you know, it does reassure patients. You know, it attracts patients. It you know, they look like my teeth, the ones at the bottom of the chair. I have hundreds of before and after photos. So you use split pick, you can use Insta Editor, and you know, you can use a very simple camera, which I'll show you in a moment. And it is a visual world, you know. It is visual now. There's less writing. Facebook even know that it's a visual world because they will ban your adverts if there's more than a third writing on the photo. So there's my photos. People will look at it and go, "It's absolutely pants." But you know what? It sells. It gets me patients through the door. It's enough. And I think, you know, I don't want to be that photographer that has the amazing porcelain-looking teeth close-ups. Do you know why? That doesn't sell. My picture will sell more than those close-ups, those amazing bits of photography that we see on social media. And I can promise you that camera, and you know, I got it for 200 quid. You know, and it's well, it says 335, but I got it for second hand even, and it's got a nice little ring flash. You know, you don't have to go for something expensive. And actually, that's a fish camera. It takes me probably 3, maybe I would say 20 minutes to do a full assessment, and my full assessments are GDC seen. And you know, so I do a thorough assessment, of which, you know, if anybody wants notes or that, I can show them how I do my full assessments, because, you know, I did learn it the right way. But you know, this is so easy to do. You do it with one hand and off you go. You do the 12 photos and out the door. It's a really good camera. And look, improve your clinical conversion skills. I probably have increased 90% of turnover by just increasing my my conversion skills, and when they're improved, you know. And I do a course on increasing clinical conversion. I can't bear this bloke. I love the film, Leonardo DiCaprio, and I've actually been barred from the guy that he played, the salesman he played. He's got Belford. John Belford, I can't remember his first name now. So he's got a group, and I went on the group and I said, "Hey, can you give us all a shout out?" And he actually barred me. So I think I'm the only person that's been barred by this fella who he played. But you know, he was right. This pen, he was saying, "Sell me this pen," and the reason for him saying, "Sell me this pen," and they were all failing because they were talking about the pen. You know, don't go and try and sell a crown about the crown. You sell a crown because you want to find out why that person wants to buy the crown. That's all it is. It's questions. It's 2 ears, and you know, 2 ears and 1 mouth. You listen more than you speak, and that's what this was all about. It's the fact that he was trying to sell the pen and saying, "Sell me this pen." In other words, you know, you've got to make me want to buy the pen. Why do I want to buy the pen? Now, this thanks to Portman buying my practice. This is the car I've just bought, the Bugatti La Voiture Noire, 7.8 million. I'm only kidding. No, I haven't really bought that. I think that is a complete and total waste of money. My kids would be in there, and it would probably look like 10 minutes they'd have it in there with their crisps and sweets. However, I did buy a car recently, and I talk about that story a lot because I went in and it was an electric car, and you know, it wasn't a cheap car, and the guy didn't even offer me a test drive. That's unheard of. But he was so skilled, Mohammed. He was a lovely, lovely bloke. And he realized really early on that it was the kids that were driving me to buy an electric car. And what did he do? He sold it to the kids. He took the kids into the car. He took the kids and showed the kids where the dog would sit. And I said to him at the end, I said, "Right, we'll do the deal." So we did the deal. And I said to him, why didn't you offer me a test drive? And, you know, it will stay with me for a lifetime. And he turned around at me because he didn't want one. I mean, how talented is that? He knew why I wanted to buy the car. And do you know what? That's the secret of selling. just look them in the eye, see it from their point of view, and find out why they're buying. And the only way to do that is to ask questions. So the perfect consultation. So you're 3 times more likely to convert if the consultation has a structure to it. And why is that? Because on a Friday afternoon, when you're absolutely bloody knackered, you want to go home and you're thinking, oh my God, this patient, and the patient, you know, it's a classic, isn't it? They sit there and they go, I'm shopping around, or I've been to 2 or 3 dental practices. How much do you charge? But that is probably one of the biggest killers of a good, secure, firm consultation. So you just got to breathe a little, sit back, and go through the process. You've got to sell it to them, find out why they're buying. And you know what? They might be buying for financial reasons. They might be buying because they're financially driven. But so what? So what? Why can't they be? Most dentists I know are financially driven when they're buying something. So why can't patients be? And I think that we're getting lost in our profession because we are teaching the younger dentists that it's not okay to be a purchaser or someone who's financially driven to buy treatments, who want discounts. It's okay, you know, it's okay to give free consultations. It's okay to respect the patient who's sitting in the chair because they want a cheaper deal. You can say no, but you don't need to get upset about it because they're just driven by money. They've got that passion to acquire back when we were talking about earlier, and they just want things cheaper. So if you just sit there and just breathe through that and go through this structure. So my structure, this is my structure. So this is what I do every single time I do a consultation. My nurse, bless her, always goes out to collect the patient. Why do I do that? I don't know. It's not laziness. I've just got that structure in my brain, and I've done it for years. When they come in, I'll introduce myself and briefly offer my experience. I will always drop in. I am the only diamond Invisalign provider in Devon. Now, with the patient, with the stuff I get from reception, which I haven't got time to go into, I will get information from reception, and I will then discuss that with the patient. Now, the patient's suddenly going, how the hell do you know all this about me? And I say to them, because we've had a management meeting about you, because you are the most important person in the room. Now, suddenly they think, my God, this person is listening to me. Now, I haven't even looked inside their mouth at this stage. I ask the patient why they've come to see me, and usually we give them a mirror. Now, if they put the mirror right up to their face, worse still, if they go into their bag and they pick up the magnifying mirror, I think it's time just to walk out and say, look, I've got to go home. But look, you know, give the mirror to the patient and then get them to list their issues while my nurse is sitting typing away and listing out their issues. Now, this is the secret. This is my mnemonic, whelm. This is what tunes in to find out why someone wants to buy. So it's why. Why do you want a nice smile? It could be a wedding. It could be anything. It could be my husband's asked me to come on. It doesn't matter what it is. I ask them what emotion is attached to it. What do they feel? What is it? What is the emotion they attach? It could be happy. It could be elated. It could be anything, because that is now tuning into the person's feelings and why they're wanting to come to you. Because they know your prices, by the way. They all know them. They know your prices. They've seen them on your website. They don't think for one moment when they say how much is Invisalign, they don't know, because they do. They know, because they've either shopped around, they've seen it on your website or whatever, but you're trying to talk about the emotional side of things. How long is probably one of the most important things, because how long someone has wanted something is quite significant. It could have been from a childhood, it could have been from bullying, it could have been from a bad marriage, but that really can bring along a discussion as to why they're wanting to buy from you. And obviously, what does it mean to them? What does it mean to them having a beautiful smile? So they are the 4 things that I go to. Then I go to my nurse and does the scanning. Now, I promised that I would give Lauren a shout out. Lauren is my nurse. I'm not allowed to say her second name. Happy birthday, Lauren. Well, it's not actually her birthday, but how else am I supposed to shout out my superstar nurse? She does all the scanning, and at that point, I can see whether the patient has a class 2 div 2, class 2 div 1. I then put the TV on at the bottom of the chair, and then the patient will be sat up, and I will talk about the ideal versus compromise, and obviously the retention process and scans. Again, I'm happy to send Andy my notes. They've all been checked, and they are pretty good. And I can tell you they have got me out at some stage because they are, quite to the point. So I do talk about the ideal versus the compromise. So it would be surgery all the way down to fixed braces, and then the last one could be maybe a single arch, limited outcome with just the front 4 teeth. And obviously, you have to also mention they can walk away. I then talk about timescales and outcomes, and then I give a smile promise. I absolutely promise my patients that at the end of the day, they're going to be chuffed to bits with their teeth. I give them that promise. Why? Because it raises their hopes. I will give them their promise. However, I do say to them, but first you need a supercharged checkup for me to provide that promise for you. So it's not so their decision anymore, it's your decision, because you need to make sure that they're healthy to have the treatment. It almost balances out the energy in the room when you say that, and you then book the patient in. But remember, you must say in your notes, patient-specific risks. Now, when I started dentistry, you used to be able to stick a crown in, zinc phosphate. Well, I didn't even write that. Fitted crown upper left, exam, S&P, bite wing, job done. Now, it's not good enough to just copy and paste loads of stuff into your notes. That is not what the GDC want. The GDC want, yes, they want that. Yes, they want you to give them all the warnings, but they also want patient-specific risks. What is specific to that patient? So at that point, I will actually do the patient-specific risk as well. So it could be resorption, it could be recession, it could be pain, it could be they need bonding, whatever it is. So make sure, and that's it. That is my consultation, and it's the same one. It must bore Lauren to tears, but it's the same one I do on every single patient. Now, don't forget though, this is the purchasing ladder of awareness. Now, we've all been there. Patients will sit in your chair and you'll think, this is easy. The patient has said to you, I've got a brother and a sister, and they've all said you're amazing, and you sit there and think, this is going to be an easy sell. In fact, I'm not even going to go through my normal process. I'll tell them the cost, take them outside, book them in, job done. Now, that's because they're ready to buy. They're at number 6. But there's other patients who are not at number 6. They may be at number 2. So when someone comes through the door as a normal dentist and they're sitting in the chair, they don't have a problem, or they don't feel they've got a problem. You've then got to tell them they've got a problem, so that the patient is warming up a little bit. They're not ready to be told that they need £3,500 of implants. You also, they get to, I know you can treat this, so now they're starting to warm up. They're still not ready to be told that that's how much the treatment will be. Now they're starting to warm up when you tell them and you show them the actual solutions, and they can see you have that solution. But it's only when they can see the benefit that they're ready to be told the price. And that's why before Portman came along, I would not, and it's the same today because they haven't changed anything, that my staff I try and get my staff to avoid telling the costs over the telephone. So in other words, if they ring up, they are not to say, oh, well, great, that's like £3,500. They're not to say that, because patients, they'll be only on number 3. You tell them that, they go, thanks very much for that. They need to have some kind of nurturing up that purchasing ladder of awareness. Now, if you're sitting in the chair and you're anxious about telling the price, it means you're not ready. It means the patient's not ready. It means that you're looking in the eye and you see it from their point of view. In other words, you haven't gone through the natural process of selling. You're there thinking, if I tell them the price, I'm not ready, I'm anxious, it's not right, then it's not right. Then you bring them back, then you can do more scanning, give them more time. Because usually the anxiety of the clinician in telling the price, it just means that they haven't brought them up and they haven't gone through the natural process of selling. And there we go. I've done probably with my team outside Portman about 150 practices, mystery shoppers. That is the most important thing to get right. It doesn't matter if you're an associate, it doesn't matter if you're an owner of a practice. We've done 150 mystery shoppers. 148 were terrible, and that was one of the results from one. We were told to look on the website if I was interested in the price. 148 were bad. That is shocking. And do you know what the bad thing is? One of my practices was one of the 148. Bless her. She was a trainee. She didn't know what she was doing, and I hadn't trained her, and it was totally my bad, my responsibility. And now she's amazing. She'll come through and go, Grant, we've got 12 new patients, and I got them, and she's brilliant. So look, you know, I can't stress it enough. That is the killer. That is the bleeder in our profession, is reception. Not because they're not any good, it's because you haven't trained them. And it's okay as an associate to go, you know, and we all know, don't we? We all know as dentists that we can walk into reception and you almost tighten your bum cheeks and walk out again. So you really can't cope with the conversation the receptionist is having with the person on the telephone. But that has to be dealt with. That has to be dealt with. And it can be tough, you know. It's probably one of the hardest things to do. But I made sure I dug deep, and I made sure I put things in place so my staff were brilliant, and they are brilliant. And you know, Portman are you know, bloody lucky to have them. So get that right. So number 10 is, if it all screws up, fess up. When it all goes wrong, and it does go horribly wrong, just you've got to respond quickly. Keep your responses brief. Don't try and make excuses. Just own up, apologize, offer to fix it, but make sure you follow up on your promises. I've seen it. I've seen people on social media and they go, "Don't worry, I'll get all my friends to leave positive results to drown out the negative one." Oh my God, don't do that. What I would do, I remember on the day of the sale to Portman, we got a bad review and I thought, this is really the wrong time. So I rang the patient up and I said to him, how can I make this right for you? I didn't talk about the review. Don't mention the review. You just say, you're not happy. How can I make this right for you? Now they'll probably come back and go, I want half my money back, or I want my money back, or I'm not happy about going on with the treatment. And then at that point you can say, well, I'm comfortable giving you half your money back. And if they then agree, or all the money back, if they agree, you then say, as long as you take down the bad review, are you happy to do that? Because they're on the up. You've agreed, they're happy, and then you say, are you happy to take the review down? Fortunately, the day of the sale, they took the review down. So that was great. All happy ending. And you know what? You've just got to remember, in all this, it doesn't matter how good your marketing is, how good you are as a dentist, you don't want to lose a patient in all the chaos. We are so obsessed with automation. And I think I can't bear full automation. There's still a human at the end. I don't want robots everywhere. I like a robot on the website. I'm doing one now, but I just automation is awful. So I've designed what we call, it is a Trello board. So it's www.trello.com, and I've actually got a board for new patients. So it'll be first consultation, full assessment, investigations, profile, patient half, paid half, treatment booked in, and it goes all the way along. So I've designed the whole thing. And as you go along with the patient, Mrs. Smith, I can move the patient all the way along. So you don't get that night sweat just before you go to sleep. Go, oh Christ, what happened to that patient? That full arch, I didn't get back to her. She's on your Trello board. You can look in the Trello board, and you can even go to, it's perfect, It's got everything. You can add x-rays, you can add notes, you can even invite a local implant person, and this CRM, or whatever they like clinical management thing, it's free. It doesn't cost anything. And that's all that I do with regard to the stuff I do. I like free stuff. It's probably the blood in me. But do you know what? Is this all luck? Is this all luck? Is it luck that I managed to build a practice, or 5, 6 spot practices? Do you know, it possibly is. A friend of mine, they built this bloody restaurant in the middle of the ocean or in the middle of a lake, and they said, Grant, can you help us? And I went, I can't help you market that. You've put the biggest barrier between you and your customer. But they're packed. The business is massive. It's worth a fortune because they have rich people come down on yachts. So maybe it's all luck, Maybe it's luck. But the most important thing to remember, and I think above all, it isn't rocket science. Boom, Andy, done.
Grant, that was amazing. Thank you so much. I'm just going to bring myself back into the screen. So
that could have been really awkward if you weren't there and I'd have to repeat that.
Well, Grant, as well as I do at Portman, we are consumer professionals. Listen, I've got a couple of people with their hands up, so I'm just going to give them fair warning. So Jeevan and Jill, I'm going to come to you in just a second. But before we do that, I've got a couple of questions in the chat box, Grant. Grant, you spoke loads there with such passion about all your successful tips. Somebody's asking if you could condense all your top tips into one as a success as a dentist. What would your top tip be, Grant?
Do you know what? It has to be, you've just got to see it from the other person. And that's, when I talk to you, Andy, when I have an argument with someone, it doesn't matter. It's life, isn't it? It's seeing something from the other person's perspective. And if you can do that, if you can come outside yourself, it doesn't matter what you do. You'll be a success at anything. I mean, I could go and sell a car and have absolutely no clue how to do it. I could just say to the person coming in, why do you want the car? What do you want it for? What's the reason for it? Have you got dogs? And you just get the person talking. You're just seeing it from the other person's point of view, and that is it. That is the whole thing about life. I think it's about not being. It's the opposite to narcissism. It's just to find out what the other person is, and if you screw up, just say, I'm really sorry. It's just that is it. That is the one thing. That's me selling golf balls as a kid. I could see the Americans. I could see it from their eyes, and I could see it from the Brits, and that's it. It's just seeing it through their eyes.
All right, lovely. Thanks, Grant. That's fantastic. Jeevan said he hasn't got his hand up after all, but Jill, you've still got your hand up, so I'm going to take you off mic, Jill. If you can unmute yourself your end, and feel free to join in the conversation and ask Grant a question. Have you got a question for us, Jill? Jill's still self-muted, so actually, Carlene's hand has gone up in the meantime. So, Carlene, I'm coming to you. I'm going to take you off mic. If you can bring yourself off mic, your end. That's Carlene Wilberger. What question have you got, Carlene? Let me go to the chat box then, Grant, because I've got another couple coming in here. Somebody's asking, Helen's asking, you spoke about Invisalign on Facebook, Grant. Any chance that anybody on email, if anybody emails you, how can they have a look at an example of your Invisalign ad on Facebook? What's the best process there, Grant?
So right. So sorry, I don't understand the question. Are they wanting to copy someone else's advert, which is fine. I used to copy people's adverts all the time. There's a way to do that. Is that what you mean? So she can see the copy and see the way I advert, or
yeah, can we see an example of your Facebook ad for an Invisalign open day?
Okay, all you need to do is you go on Smile Direct Club. All right, and I'm quite happy about saying this. They spent billions on their advertising. You go onto their homepage. On the right-hand side, you go down to page transparency. You click on page transparency. You then go from page transparency to the ad library. You click on ad library, and it will show you all the adverts they've ever put on. So that is the best way to cheat. Just don't job all theirs. Don't job mine. But yeah, you can do that. So it's page transparency on the home pages on Facebook of things like Invisalign, Smile Direct Club. I mean, don't job it off dentists because it's a bit unkind. I'd go to someone like Smile Direct Club or something. That's what I'd probably do, or Frank Smiles and all them. Because they're clever. You can't get away from. They're amazing marketers. They're brilliant marketers.
Yeah. Makes great sense, Grant. Thank you. A question here from Misbah. Do you think it's worth these days setting yourself as an associate, as associate, a page to show your cases, etc.? I've always found social media attracts the wrong type of people who want everything for nothing. Brilliant question. What are your views on that, Grant?
I said, over the years and the squats that I've built practices on different methods, and I built a practice on, social media, Instagram. It's just the reason why they're wanting something for nothing. You've just got to remember it's not necessarily they want something for nothing. It just means that there is more chance of them getting something for nothing because they've got everybody on their fingertips. So I've got a very transient population. So they'll come in, they'll go, and but I suppose there are ways to do Instagram to make it easy for yourself, because you can do the little responses. You can do direct responses. It's in the, if you go into the bits where it says the messages, there's a little arrow. You click on arrow, then you go down to the lower right, and there's 3 buttons. You press the 3 buttons, and you can put set questions and answers in there. So you know what they're going to ask. You just copy and paste, job done, send it out. That's me, job done. So, you could almost, your question is, do I think that, as an associate, you should build it? You've got to work out why. Why do you want to build it? Because I tell you what, if you build it and then you want to build your own practice, what do you do then? It's difficult. It is the super associate, isn't it? I know now as a Portman, I have absolutely no wish to start my own Facebook page, and I just can't be bothered. Can't be bothered with the hassle. Let someone else deal with that. And if you want to do that, that's how you build practices. Is Instagram, Facebook, Google My Business. But just move on. Just go and do your own thing, I think. Or just let someone else do it, or ask to be involved. Phone up your Ryan and ask them if they, if you're a Portman, phone up and see if they can get involved in it. I mean, if you want to learn it, why not?
So inspirational, such great words of wisdom. Thank you so much, Grant. We have actually come to the end of our time now. Grant, tell me, on a scale of 1 to 10, this is the first time we've worked together this evening, and we were both chatting about nerves before we came on air, weren't we? So on a scale of 1 to 10, how are you feeling now, Macy?
I have wine in here, by the way, everyone. I do drink wine in this, so that helps. But I was nervous. I think you said a lovely saying at the beginning. What was it again about nerves? It's time to go. Who said that?
It was Laurence Olivier, because Laurence Olivier once said, the day I give up acting is the day I lose my stage fright. In other words, it's completely natural to be nervous in situations like this, isn't it? Finally, before we go, Grant, and I'm going to give a shout out to the next session as well. In case anybody's got any questions that we haven't got around to this evening, what email address can they contact you on, matey?
Grant McAree, MCAREE @gmail.com. Gmail.com, Grant McAree, or Facebook, or Google, or I've got an Instagram and whatever. Be lovely.
Fantastic.
And I'm happy to give anything free away. And I've got a Facebook group with about, I think, 5,500 dentists on there as well, called Dental Marketing and Facebook, and Dental Advertising, Dental Business and Marketing Group on Facebook as well.
Brilliant. You're an absolute diamond, Grant, and such a strong opening of our Fireside Series. Thank you so much for this evening. And I'll give you a call soon and we'll chat. And lovely working with you this evening. Okay, team, so that's it.
Thank you.
Oh, a real pleasure. That's it from Grant and myself this evening, team. Tune in a fortnight's time on Wednesday, the October the 13th, and we're going to be having a conversation around the difference or the benefits between implants and endodontics. We've got two cracking clinicians coming along to talk to us about that. Dr. James Critchley, who is well into implants and does a lot of them around the Portman estate, and Dr. Fred Ferreira as well, who is a specialist in endo, of course. So join us at 7:30 in a fortnight's time for that conversation between those two aspects of dentistry. In the meantime, Grant, thank you once again. Keep safe, everybody, and we'll see you in a fortnight at 7:30. Cheers for now.
Good on you, buddy. Take it easy.
Take care. And you. Bye-bye.